It's a great achievement. I know we are not where we want to be, but we are not where we used to be. So certainly there's more room for improvement and advancement. Hi, welcome to the Chronicles of an African Diasporanist. Thank you so much for tuning in. Today, the topic that we are going to discuss is something that is dear to my heart. And I believe that it's a subject that we all ought to be interested in and also be curious about in terms of how it applies to each and every one of us, our friends, our families, our colleagues. I am so glad that I've got professionals joining me from Ghana to talk about this very important topic. So I will let them introduce themselves to you.
My name is Owusua at Gyapong, a community mental health nurse, a senior nursing officer, and deputy nurse manager of the community psychiatric unit at Pantang Hospital.
I'm Dr. Narkwor Narteh, a specialist psychiatrist at Pantang Hospital.
First of all, I would like you to tell us a bit about mental health services in Ghana. Try and if you can summarize it for us in terms of infrastructure, human resource, the day-to-day running of mental health services.
So basically, there are 3 psychiatric hospitals. So we have the Pantang Hospital, Accra Psychiatric Hospital, and then Ankafo Hospital, Psychiatric Hospital. Yeah. But aside that, there are community psychiatric nurses who run the various psychiatric units in some of the hospitals in the communities. Then we also have now some of the regional hospitals also have psychiatrists running them. For now, there are about 60 psychiatrists in Ghana. So you can see that we've come a long way from the very few. Yeah. So now, and there are about 50 or so in training. This year, hopefully, about 10 or so will be graduating. That's when they pass their exams. So basically, we have come a long way. We haven't reached the ultimate, but with time, we will surely get there.
Thank you. Thank you. Is there anything else you want to add, Akua?
What I'll also add on is that, like Dr. Narkwor rightly said, now we are concentrating more on the community-based care, where people can be having mental health issues or diagnosed with mental illness and can stay in their own homes and receive their treatment. So community mental health nursing is really what we are all looking at now. Like, people should be in their homes, then they receive their support so that they can be well reintegrated into the communities. So we create awareness. You know that stigma is one problem that is affecting our mental health care or the treatment in our parts of the world. So in promoting the community care in a way, we are also trying to bridge the stigma or to educate people, let people be aware of mental illness and its like causes, risk factors and all that. And once people begin to understand it, they embrace and people who are having mental health issues, and the stigma is quite less on people with mental illness and their families. Yes.
Yeah. I could agree with you more, Dr. Narteh, the fact that we've come a long way. The first time I came to Pantang was 2006 when we came to deliver training. And then there were only 2 psychiatrists then. And so from that time up until now, to have over 60 psychiatrists and having established like the community mental health teams and taking care into the community, I think it's a great achievement. I know we are not where we want to be, but we are not where we used to be. So certainly there's more room for improvement and advancement. So I'm aware that there is a proposed mental health awareness month. Normally we hear this in October. So why May? Why mental health awareness month in May?
So as you rightly said, we used to have the mental health program in October, but we realized it is the same month for breast cancer awareness. So sometimes it's like there is divided attention between breast cancer and mental health. Yeah. So we decided that this year, as you can see, other countries like US, UK, and the others, they have dedicated May mental health awareness. So looking at all those things, we decided that, okay, why don't we also have a month whereby from the beginning of the month to the end of the month, we can really create awareness. And you can see also that in May, there is no other medical condition which is being highlighted for that month. So that's why we decided to use that particular month to create an awareness.
That sounds very reasonable. I can imagine, because already mental health doesn't get the attention in terms of everything, in terms of funding, resources. So I can imagine it competing with popular topics at that time. So I think this is really a good idea. So what is the message that you are putting across in terms of the Mental Health Awareness Month? What do you want to put across to everybody?
Okay, so I'll take this one. So the Mental Health Authority, like Dr. Narkwor rightly said, has moved the celebration from October to May. Yeah. That is starting from 29th April. Have the official launching by the Mental Health Authority, and then all activities will roll in. So the theme for this celebration is movement, moving more for mental health. So we are all to move, like everything that we are doing, we should be moving, promoting mental health. And the focus is on maternal mental health as well. So this year, that's the message. We are targeted corporate organizations, workplace mental health, talk to people about maternal mental health, and create awareness basically on all aspects of mental health.
As Akua said, we are moving more for our mental health. So the movement will involve every aspect of society. So the churches, the schools, the mosques, every corporate institutions, everywhere we are entering. So there will be community outreaches, there will be mental health talks in various schools, both basic, private, basic, public basic schools, the secondary schools. We are basically trying to ensure that at least everybody gets to know what mental health is, what the signs and symptoms are, and how to identify it early and seek early treatment. And also, it will also serve as a form of trying to get people to reduce the stigma against people with mental health.
Thank you so much. So you talked about maternal mental health, and this brings to mind perinatal care. How is it currently in Ghana?
We know that for the maternal, their first point of call will be the primary health care. And then the obstetrician gynecologists, they are the ones that most pregnant women and lactating mothers will first seek care from. So our plan is to educate all the health staff in the primary care setting, so that by the time either a pregnant woman or a lactating mother comes with mental health issues, they are able to pick it up. Once they identify the problems, then solutions can then be found to it. And we always say prevention is better than cure. So, and also identifying the problem is also part of the solution. We have a long way to go, but we will surely get there.
Definitely, we will get there. So the activities that are planned,
I wanted to add on to the to the discussion, the topic that you just mentioned. Yes, so like we initially said that there are community mental health nurses or community mental health units in all the government hospitals, the polyclinics, even some of the charge hospitals also have mental health nurses. So as part of our activities, we give health education at the weighing department, at the CWC or child welfare clinics, at the postnatal clinics, at pregnancy schools and all that, so that we create awareness. We let the mothers and all the staff know the signs to expect, or when to see that somebody is going through mental health issues and all that. So we have like the care or the talk has been decentralized. So we target the mothers, like the target groups, and then we give health education and create awareness so that people can easily detect where when somebody is exhibiting mental illness. And like Dr. Narkwor rightly said, then early treatment saves life, or prevention is always better.
Thank you so much. So all these activities, I know both of you are based in Accra. Is this nationwide?
Mental Health Authority, they have rolled out program or activities for every mental health facility, region, district, all of us to tap in and then work towards it. So whatever Pantang Hospital is planning, it's incorporated in what MHA as a bigger umbrella has for all of us.
Thank you for the information on all the activities that will be happening, nationwide, also locally. So I am asking, what support is needed? Obviously, you've planned all these, and my understanding of mental health budget allocation is that it's always been very, very tiny, and that has a knock-on effect on the day-to-day running of services, patients' medication, etc., etc. So with the scale of the Mental Health Awareness Month, what support is needed? And it could be material or monetary or whatever, moral support, all kinds of support.
Okay, so for Pantang, we have an occupational therapy department.
Yeah.
And over there, we have a child and adolescent mental health project. So we want corporate institutions and partners to come and support us to renovate the occupational therapy department. And this will help us to provide, excellent mental health care for children and adolescents. Also at the occupational therapy department, we want to have a small conference room whereby we'll have teleconferences services. And this will help to train our staff and other professionals so that it will serve as a form of training center for our staff to help in delivering mental health services.
Yeah.
We'll also be visiting schools, churches, and other organizations, and we'll also need funds to help us in terms of going to all these places to educate them. So we'll be grateful if corporate institutions can partner with us and help us. On the 25th of May, we'll have a hike for psych, whereby we'll walk to Ebri.
Yes.
So we'll be hiking to Ebri, and we will need, it will serve as a form of exercising, creating awareness, and also we'll use that opportunity to also raise funds. So we'll encourage everybody to take active part in all our programs.
The hospital also has a project that is running called Set the Captives Free, where we pick patients from the streets, bring them to the hospital, take care of them. When they are well, they give us directions to their families, or they give us contacts of families sometimes, and then we are able to trace their families, and their families do come for them. So as we are moving mental health, we said that moving more for our mental health, we want to move on the streets as well. So Pantang Hospital, to celebrate this mental health month, we are even picking 10 of such patients from the streets. So we call on everybody to come and support us, even if not monetary, how we take care of them there, their clothing, their toiletries, water that they will drink, any form of support. We appreciate it. Thank you.
Thank you. What message do you have for other health professionals who don't work in the mental health system? Because I'm aware that sometimes our colleagues who are not even here, some of our colleagues who are not in mental health, they have a different approach to mental health professionals or the way they view us. So first of all, what would you like to say to your other health professionals who are not in mental health?
Basically, whenever our patients come to them, they should treat them with care.
Yeah.
Because we are all humans. Mental health is just like any other chronic condition. So just as we have patients who have hypertension, diabetes, our patients with mental health conditions too, most of them are chronic conditions. So they should just consider them as just having any other chronic condition and then treat them with care.
To our colleague mental health professionals in the diaspora, we want to call on you, all of you, to join us in this celebration. Like we said earlier, the celebration has been moved from October to May. We need all of you to support us in any kind. If you have even learning materials, educational materials, you want to support us in monetary aspects, any way or any form you want to support us, even give us platforms to create awareness or to even talk to people about programs, just like Auntie Rita you've done, we really appreciate it.
I agree with Akua.
Yeah.
So with the diaspora, at least you are exposed to so many, you have better facilities and all that, and you have maybe some items you might want to donate. For instance, like I said, our occupational therapy department, where we treat childhood and adolescent mental health. At least they need learning materials. They need materials that they can help in training the children in terms of their activities of daily living and all those things. So if any of them have any materials or they have any donation in kind, they can do so, and it will be greatly appreciated.
What message do you want to leave the general public? And after speaking English, I think you can speak Twi as well for this one, because it could be anyone watching, and probably some may not even understand English. So, message for the general public in terms of this Mental Health Awareness Month.
Okay, so the message is just simple. We are all moving for mental health. So they should join us in the movement. Number 2, they should try and stop the stigmatization against patients with mental illness. Just like we say, almost every household, there is somebody with a mental health issue. So, and if their relatives are brought to the mental health facilities and they are well, they should try as much as possible to come for their relatives. The fact that somebody has a mental illness and has come on admission and the person is now well and can be integrated back to the society, it means the person needs to go back home. So we will encourage them that when their relatives get better, they should accept them in their house and ensure that they treat them like the way they would treat every patient with any other condition.
I will speak Twi. Yes, sir. Yenuanum adofo bia o tie eni obi o hwe yes sir mo. Yes say nanka afi bia ya yedi ye mental health in Jumedie no ene celebration yedi no October, but afi we mu de ye de aba May bosomi mu. Nti na ye kan say ye nyina ye nye bibi a ebe improve mental health. Eye ya adwen mu apomudi ye hu hia ye pa na ye bia ye nwene ho hwese ade a me ye ana asade a me di ye me nuen eya ade a ebe bona na adwen ho apomudi ho ban ana se de na ekọ osem iti ye ndodo ye hu sesebi ya obi wo adwen mu yare ne ye de na ba yare sabia na ya beje yare sana osan befia ma ye nye yimu ma ye ntwetwe ye ho wosa anipa no ho ye ne ntena odro ebe che nipa no it goes a long way manipa no ultimate 15 community nim ene ye tena kama na se ye twetwe ye ho woni pa no tele bi etumi ya sa na nipa na dwendwen ho ana asebe akọhye ne ho kra akonko menyi ni se nyina ye pese nam yeso na ye nua bi kọhye ne ho akonko na bibisa ti ne ye sere bi o me se dwumede ya ye di se ye ba obi anim a omie ne pno mai na ye nyina ye nche mental health ensem no se say ye preach mental health na ye nyina ye preach mental health no guarantee. That's it.
Thank you, Akua. So it's all about social inclusion to minimize the stigmatization. We should be able to include our friends and family who have experienced mental illness in one form or the other. That's how we all overcome the stigma. The last question is, if somebody wants to have an issue and they want to contact mental health services, how can they make contact?
They can contact us through our email, secretariat@pantanghospital.gov.gh, or they can call us on 0551 585830 or 050 193 7646.
And there are toll-free numbers too. So Pantang Hospital has dedicated a toll-free number. MHA also has one. So I'm going with the Pantang Hospital. Sorry, let me go with the MHA one first. So MHA has dedicated a toll-free number, like I said, which is 0800 678 678. So I'll put that one too on the chat. And then Pantang Hospital also has 0800 300 200. So these are toll-free lines when you call at no cost.
Thank you so much. Thank you, Akua and Dr. Narkwor. Thank you for shedding light on the program. And hopefully, I am praying that it will be a success and that you'll be able to reach all your targets and objectives for this program. And I wish you all the best.
On behalf of MHA, on behalf of Pantang Hospital, our hospital director, management, leadership, staff, and all our clients, we say a very big thank you to you for this platform that you've given to us. We thank you very, very much, and we are very grateful for this opportunity to let the whole world know what we are doing in Ghana as part of celebrations for our mental health month. Thank you very much.
Thank you anytime. There is no health without a good mental health. So as we celebrate this Mental Health Awareness Month in Ghana, I hope that you will join in any way that you can and embrace someone, check on someone, call someone and find out how they're doing. Mental health is everyone's responsibility. So thank you for watching. Until I see you in the next one, take care. Bye. And don't forget to subscribe.